So, what are we looking at? Whether you're a radiologist like me or any other clinician looking at medical imaging, you probably ask that question a lot. Imaging, it's an integral part of healthcare. Because the fact is, experts estimate we're doing upwards of 4 billion imaging studies a year all over the world. That's an incredible number. And with radiologists under so much strain, it's vital that every imaging study that we read lets us make a first-time right diagnosis. Now the good news is radiology and the technology behind it, it's getting better all the time. And that is why I'm super excited to kick off a new video series where we look at medical images through the eyes of global radiology experts. I call it, So What Are We Looking At? And if you're a clinician, or if you're just clinically curious, this series is for you. Think quick medical case reviews, bite-sized short clips, so you can see how experts are making use of the latest imaging technology. Now to get us started, I recently attended an annual meeting of some 250 experts in CT. I had the opportunity to go through many clinical cases with them to see how they're leveraging spectral CT in amazing new ways. For example, they're using spectral to better visualize coronary arteries, including better intrastent visualization, reducing the beam hardening and the blooming artifacts. They're using spectral to markedly reduce IV contrast, making every drop count, while still maintaining or even improving image quality. They're using spectral for faster definitive diagnosis of cancers, like one-and-done diagnosis of benign cysts versus malignancies, or quickly identifying post-ablation changes in the liver versus the more ominous enhancing viable tumor. And they're able to quickly differentiate active extravasation and bleeding from other fake-outs, things like bone fragments or enhancing lesions, in the GI tract and in trauma cases. The imaging that they shared, along with their voiceovers, it's truly fascinating, and I think you're going to agree. So now, let's hear from some radiologists as they answer the question, so what are we looking at?